So now it is a question answer time. So let me take up the questions. My colleague Ms. Asma has collected the questions for me. So let me go through some of the last week's questions before I go into the present week's questions. So the last week's questions, the first question is from Mr. Jiju Varghese. If you're watching this, is there any drug-to-drug interactions if someone is using iGlow, iVed and iCOFFEE? Absolutely not. So far as the definitions of our Indusviva products are concerned, there are four important definitions basically. Amongst those four definitions, we call one definition as alternative. The meaning of alternative is all the Indusviva products for that matter does not have side effects and it can be used safely along with other medications and supplements also. I hope my point is clear to you. So the next question that I am seeing here is by Mr. Sai Kumar. One of the customers reports before iCOFFEE it was 190 and 290 was the sugar levels. After 2 months it is 290 and 400. What is the suggestion that has to be given here? See, I'll tell you one thing. So suppose if someone's sugar level increases after consumption of the iCOFFEE, what you have to do is, as I told you, one part is the diet. You should cut down on the carbohydrate, protein and the fat diet. The second thing is you have to continue iCOFFEE in the following way. Stop iCOFFEE in the morning times. Afternoon, half an hour before lunch it is 1 sachet, and in the evening it is half an hour before dinner it is 1 sachet. If you consume it in this way, automatically the sugar levels can be brought under control. I hope my point is clear. The next question is by Miss Deepthi Beda. If you are watching this, type 1 diabetes, how to use iCOFFEE Black? In the same way, 1 sachet in the morning, half an hour before breakfast, and 1 sachet in the night, half an hour before the dinner. This needs to be used. The next question is by Mr. Joshi Panakkal. How long type 1 diabetes should consume iCOFFEE Black? At least for a minimum period of 3 months if it is used, it is always beneficial. So the next question is by Mr. Jisha Varghese. After consuming iCOFFEE, blood sugar levels are getting high. What could be the reason? So one reason what I can tell you is, in India, pan-India if you see, around about 5 to 10% of diabetic population have high or impaired sugar metabolism criteria in their body. Such people will react. For example, in such people, whenever you consume iCOFFEE, it is always the impairment in the sugar levels usually happen. That is the reason why you have to stop consuming iCOFFEE in the morning times. You should continue this one in the afternoon and one in the night, half an hour before lunch and half an hour before dinner for beneficial results. I hope my point is clear to you. So the next question is, does iCOFFEE has chlorogenic acid? This is by Mr. Rampal. A very good question actually. Mr. Rampal, definitely coffee beans have chlorogenic acid in it. We have not additionally added chlorogenic acid. Inherently, naturally, chlorogenic acid is present in our coffee bean, but additionally we have not added. For benefit of everybody, chlorogenic acid is one of the best antioxidants as well as one of the best diabetic reducing agents as well, my dear friends. So the next question is by Mr. Gigi Varghese again. If someone consumes iVed and iCOFFEE together, can it boost the health? Absolutely yes. I would always suggest combination of wellness products for better health always. The next question is by Mr. Rajiv Rai. After consuming iCOFFEE, the urine smell like coffee. Is any problem in that? Absolutely no problem. In fact, your system is working well if you are getting some smell in the urine. Don't have to worry about it. Normally, the coffee beverages or even the tea beverages or even simple garlic, if you are consuming raw or more in numbers, the urine will smell like that. You don't have to worry about it. It is absolutely normal. So the next question is, what should be the order and dosage of coffee and pulse for 52 years? The first product should be iCOFFEE always in the morning. 1 cup of iCOFFEE, leave a gap of 15 minutes, then consume 30 ml of iPulse, leave a gap of 15 minutes again, then you should have breakfast. Even in the night, the first product must be iCOFFEE, leave a gap of 15 minutes, then 30 ml of iPulse, then leave a gap of 15 minutes again, then it is dinner. I hope my point is clear to you. So I'll take up some more questions of today now. So the first question is by Mr. Anand Kumar. What are the benefits of iCOFFEE apart from blood sugar management? As I told you, my dear friend, root causes of the disease and disease always. Whenever you browse through diabetes everywhere, there are a lot of reasons for diabetes. These are called as the root causes of the disease, starting from obesity, blood pressure, overweight, all these things for that matter, even kidney problems. So excessive urination, even gout or the swelling of the fingers, gouty arthritis, all these are various root causes of diabetes. So whenever you consume iCOFFEE, you are not only managing the healthy blood sugar levels, but you are also cutting down the root causes of diabetes, which are nothing but whatever I told you right now. These are all the conditions where iCOFFEE can be beneficial. So the next question is by Mr. Anand Srinivasan. Is it good to take biscuits along with iCOFFEE? You can have, but not biscuits with sugar. You can have something, a non-sugar biscuit or fiber-rich biscuit, or biscuits with a bit of salt is also okay, but not the sugar ones. The next question is by Mr. Banu Prakash. After using 3 months iCOFFEE, sugars are normal now. Can we suggest single packet a day? Yes. That single packet can be divided into 2 also. Half in the morning and half in the night. Always divided doses have most importance or more health benefits in the body. Half sachet in the morning and half sachet in the night can be given half an hour before the food itself. So the next question is by Miss Madhuri Yadav. If you are watching this, in case of insulin patients, how to use iCOFFEE Black? As I told you now, 1 sachet in the morning, half an hour before breakfast, and 1 sachet in the night, half an hour before dinner. One thing is very important here. You should give iCOFFEE before he takes insulin. At least 10 minutes or 15 minutes before the patient takes insulin. Coffee must be given 15 minutes before insulin, not after insulin. I hope my point is clear to you. So the next question is by Mr. Mohammed Saif. Gas problem after consuming iCOFFEE. Well, the wonderful question this is actually. Suppose if someone develops some kind of a gas issues after iCOFFEE, what I would suggest you to do is, you can mix iCOFFEE at least with 200 ml of hot water. While preparing itself, 200 ml of hot water you can use. Otherwise, 3.5 to 4 liters of warm water in a day's time. Suppose if a person is able to take, then the gas problems will reduce. Otherwise, while preparing iCOFFEE itself, you can add 200 ml of warm water or hot water. It will have the best health benefits. So the next question is, can we use iCOFFEE for headache? This is by Miss Reena Pal. If you are watching this, no, it is not for any headache related issues. The next question is by Ms. Nandini Chitakula. If you are watching this, can iCOFFEE be suggested together with iPulse for thyroid patients? Yes, absolutely fine. You can give it. So the next question is by Mr. Raghu, Rebel Star Raghu. If you are watching this, can we stop iCOFFEE when the sugar levels are normal? Absolutely yes, you can stop it. But whenever you are stopping it, don't stop it immediately. You should make that 1 sachet into half sachet. Then slowly you should taper and stop it. I hope Mr. Raghu, if you are watching this, you got the answer. Directly should not stop it. At least for 15 days. Half the dose you should give, then you should stop it. I hope my point is clear to you. So the last question of the day is by Mr. Medavid. If I am correct, if I am pronouncing the name right. For uric acid patient, which products to be given? You can give both iPulse and iCOFFEE in case of gout, which is nothing but the uric acid increase. So you should give half the iCOFFEE, half sachet in the morning, half an hour before breakfast, and half sachet in the night, half an hour before dinner. And iPulse must be 30 ml in the morning and 30 ml in the night, half an hour before breakfast and half an hour before dinner. I hope my point is clear to you. So this is how iCOFFEE and iPulse must be given in uric acid level patients. Okay. Thank you, Vivites, for posing your wonderful questions. There is a link which is appearing at the bottom of your chat box. Please have a look at your chat box. There is a link which is appearing. Please click on the link. You can send us your questions on the link. Definitely we will be able to answer your questions from there as well. So thank you so much, Vivites, for posing your wonderful queries. I'll again be back with another important, the product iGlow on Thursday. Till then, thank you very much for watching. Please keep watching and host this as watch parties as well on different social media platforms. Thank you so much. This is Dr. Balu Kolar, Head of Product Development and Training, signing off from the desk. Have a nice day ahead.